You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. With us, we have an expert on this topic, Dr. Yu. Dr. Yu, welcome to the program.
Thank you. Glad to be here.
Now, before we get into today's topic, your practice, tell me a little bit about it. Like, who's the typical patient? What are the different services that you offer?
Well, I do a lot of different things in my practice. I see adults, anywhere from the 20-year-olds that have nice teeth already and they just want some simple preventive routines and measures to help them keep what they have. We do sealants for them, which are protective coatings for their teeth that prevents cavities from forming.
Okay.
Because, that cliche about an ounce of prevention is better than a pound of cure. And,
yeah.
You hear it so many times and it's kind of dumb, but it's really true.
Okay.
We'll do some kind of like deferred maintenance for people who get a little bit older and they come in, they need, some crowns done, perhaps some fillings have fallen apart over the years and, things get discolored and, I do a lot of like all ceramic, like crowns that doesn't have...
So the days of metal, you don't use metal at all, like metal fillings, things like that?
No, I don't even keep it in my office anymore.
Okay.
Nowadays, really, there's not a whole lot of need for metal to go in your mouth. Another group of patients would be like, they got a lot of bleeding gums, their breath smells bad all the time, their teeth are falling apart or have already fallen apart, and then those are the ones that we try to sort of reconstruct everything and rebuild them back to what they had when they were in their 20s and 30s.
Okay.
And that can be done in a lot of different ways, whether it's from rebuilding thetheir teeth to perhaps replacing some of the ones that is just too far gone to, and then we try to help a lot of people who have dentures.
Okay.
And they suffer from wearing them and they are finally tired of having to deal with them.
So with these mini implants, you're able to stabilize the denture, like snap them in or give them a set of teeth that don't come in and out. Is that right?
Yeah. They can either be held together solidly so that it's got a really firm grip and they can chew and eat whatever they want. Or if they don't want to deal with it coming in and out, they can get them that stay permanently, just like normal teeth.
Okay, good. So now, today's topic, we're talking about small diameter mini dental implants for tooth replacement. You say it's the newest trend in dentistry.
Yeah.
Is that right?
Yeah, I think it's a wonderful development. For a long time, dentistry is just about sort of patchwork repair. You come in with a problem, we try to fix the problem and help you keep what you have. Maybe it works, maybe it doesn't, and eventually we really can't. But now we've come to the point with modern technology in dentistry where whatever you want, it can be done. We can replace your teeth that work just as good as your natural teeth. We can create things that sort of rebuild your smile and your ability to eat. And mini implants is a wonderful development in technology that allows us to do these things.
Okay, good. Now, we've talked at the top of the show that nobody should be wearing a loose-fitting denture. Okay.
Right.
Are there a lot of people where you are wearing a denture?
Yeah, there's quite a bit of people in my area that wears a lot of dentures, and some of them might not go out as much, so we don't see them. But yeah, I think there's a huge swath of the population.
Like thousands of people within an hour of your practice?
Oh yeah,
that have upper lower denture?
Yeah, thousands, tens of thousands that are dealing with dentures all the time and kind of struggling through with them, having to deal with this thing in their mouths.
But you say no more dentures.
Right. The problem with dentures is that they look like teeth, but they're not attached to anything. They float around in your mouth. But really where the future of dentistry is going is using these small diameter implants to lock them in so that they are rock solid in your mouth and can be used just like real teeth.
Okay. Well, if they're so good, and if there's tens of thousands of denture wearers out there, what's your take on why they're not doing it? Why they're all not coming in to get this done?
Well, I think the biggest reason is that people don't know about it. You know, you wear a denture for a while, and you sort of are out of the system or out of the game, if you will.
All right.
You know, you don't really go see the dentist anymore. You don't pay attention to anything regarding your teeth anymore, so the information is just not available.
Okay.
And I think part of our job is to spread that information so that people know what's available for them now. And you know, you ask the why like people aren't coming in to get this done, and you know, well, going to the dentist kind of sucks.
Okay.
You know, I mean, I say that jokingly, but I've been on the other side of the chair. I have a fake tooth in my own mouth, and I know what it's like. It kind of sucks.
Okay.
You go through this back and forth process. You come in for like an x-ray, you come in for a checkup, you have a root canal that maybe doesn't work out, and then you start to lose some of your teeth, get them removed, and then you go see more specialists. And you know, for these people who are wearing a denture, when they get to that point, they're happy to be done. You know?
When their teeth are removed.
Yeah, they get to an end point, all of their teeth are gone, they're now wearing a denture. And they're like, wow, okay, I'm glad I don't have to go through that anymore.
So it's hard to get them to come in.
Right.
Last thing they want to do is see you.
Yeah, I mean, I get it. They're wearing this denture, and it kind of sucks, but hey, at least I don't have to go see the dentist anymore.
All right, all right.
You know, our humans are flexible. You know, we adapt to our conditions, and you know, having this piece of plastic in your mouth that feels like a shoe, you know, floating around in your mouth, you'll get used to it.
Okay.
And for them, I can appreciate why they might not want to come in and see me or any dentist and just go, hey, you know what, I'll deal with this. And also the third reason that people don't come in and get this done is they feel that they're perhaps too old or too like frail, or oh, I'm not in the best of shape.
Well, how old can you be to do it?
Well, there's really no upward limit. As long as they're alive, you can still get it done. I've gone to conferences where people have presented cases where they were done on, you know, people over 100 years old. I've personally, yeah,
Wow.
yeah.
Why would somebody 80 or 90 or 100 want to do this?
Well, they want to eat. You know, it's easy for you and I to sit here and talk about and ask that question, but you know, if you can't eat and enjoy your food, I mean, that's sort of miserable, you know? It's just if you don't get to like chew and eat what you want to eat, and you have to drink all of your meals, I don't know.
Is that what they tell you? Is that what the denture wearers tell you, that it's?
Yeah, I hear that a lot. You know, the people, they tell me that I haven't had a slice of pizza in years, or I haven't had a steak from my favorite steak place. You know, we have a great steak place in our neighborhood called Jocko's, if you're ever in the area.
All right.
And people tell me, like, you know, they loved their steak, but they haven't had a chance to eat it. And you know, food is I think one of the great enjoyments of our lives, and it's I can see why they would seek this out, because they want to enjoy food again. And another reason is cost. You know, they might have been quoted the traditional bigger implants, and they oftentimes run as much as twice as much as what these smaller diameter implants go for.
But we've had people on the program, and I say this respectfully, that I've had qualified dentists say, hey, Randy, the problem with mini implants or these small diameter implants is they're too small. Mm-hmm. That it's better to go to regular size implants, that the mini implants just fall out. They don't work. What's your response to that?
Well, I have heard that before, and there's a 12-year study out there now that has followed 600 plus patients for 12 years, and they are just as successful as their bigger implants in terms of how long they lasted and how well they work.
All right. So mini implants work.
Oh yeah, absolutely.
If you were missing just one tooth, would you get a mini implant?
Sure.
Okay. One of your family members?
Oh yeah, yeah.
Okay, good. Yeah. Now, the people with bad gums, like the bleeding gums, the bad breath, they have gum disease. Can they do this, or their gums are too bad to get the mini implants?
No, absolutely they can do this. In fact, a lot of them come in to get this in order to treat their bad gums. I mean, gum infection is a bacterial process.
Okay.
It's bacteria that lives on the surfaces of your teeth, and they over time infect the gums below, and then even longer and worse, they infect the bone below, and you start to lose bone. You ever see like the really older, frail ladies, and their face has that shrunken in look? It's because, well, they lost not just their teeth, but their supporting gums and the jawbone.
Okay.
So for these patients, it's a great option, because once they get their gums cleaned up and they resolve the gum infection, we're going to get them solid teeth that can be saved, and what cannot be saved can be replaced.
So the mini implants then will work with people with bad gums?
Oh, absolutely.
After you clean up the gums?
Yeah. The gum infection disease has to be treated. But once that has been treated, mini implants are a great option.
Now, you're also big on oral sedation.
Yeah.
Because this seems like it would hurt or not be a fun experience.
Well, it wouldn't be a fun experience, but I have this one gentleman who came in and saw me, and we met a few times and had some consultations, and he was just very stiff and nervous, and I could tell that he was practically gripping the edge of his seat, just sitting there talking to me. And we gave him some medication that he took beforehand. After he was medicated, he came into the room and he was getting ready for the procedure, and he was joking with my staff, and he's not a joker, and I think he was flirting with one of my assistants, and he's always been so like nervous and stiff. And afterwards, we got through the procedure. He was like, "That was great. It feels like I sat here and we listened to music and we just hung out." And I don't know how much of the procedure he remembers, but he tells me afterwards that, hey, that wasn't bad at all. That he went home and watched some TV and played a round of golf and went to sleep and felt great.
That's it. Now, you're a dentist.
Yeah.
You think the smile is probably one of the most important things.
Yeah.
Is that right?
Yeah, I do. And I remember like the first time that I realized how big of a difference a smile can make was actually one of my first patients in school. She was a young girl, and she had some some rough edges around the teeth that was a little bit crooked, a little bit chipped, a little bit broken here and there. And I just did a very simple thing for her. I kind of evened things out a little bit and just rounded things off and polished them smooth. And I gave her a mirror, almost sort of like, no, here you go. Are we done here? Like, I gotta go.
Okay.
And she looked at it and she like started crying, and she got up out of the chair and like hugged me. And I remember thinking, what? I just did a few things, but she said that like I'm so happy to smile now. And I thought like, wow, like I made that big of a difference, and I'm humbled that I was able to do that for you. I see people who, if you don't have a smile, they tell me that they feel confined.
Interesting.
Yeah, look at all the studies that show like what is one of the first things that people notice about someone when they meet? It's their smile.
Or their eyes or smile. Yeah, it's a good point.
Yeah,
good point.
And without your smile, you sort of like never present your best self forward. You go to like a dinner party and you have a person that's frowning and not smiling all the time, and oh, let me talk to that guy.
Okay, good point. Yeah.
So I think I truly believe, and I see it day in, day out, how big of a difference a smile makes for someone. I have this one lady who I did some work on her, and we rebuilt her teeth, and a really lovely lady. And she invited me to her daughter's, I think, 30th birthday dinner one of the days. And I don't know what to make of it. I was thinking, like, are you trying to set me up with her or something? You know, I'm married, you know. But she told me after the fact, she said, no, I wanted you there because if I didn't have my smile, I wouldn't have hosted my daughter's birthday dinner. And
nice.
I was taken aback. And the smile is sort of like a window, and it unlocks somebody's like charisma and charm. It opens up like perhaps a new chapter in romance. And
good.
And
can you spot people, by the way? Like, because you're a dentist, you could spot people that are hiding their smile. Because since we've talked on the phone, on Facebook, for example, or Instagram, certain people smile with their mouth closed.
Right.
And now I'm thinking they're probably hiding their smile.
Yeah, it's, you look at it enough, and then you start to pick out these little tricks that people do to hide their smile, or, they're not confident about their smile, and they go about their day trying to shield that a little bit. And yeah, you can tell. You walk around town, and sometimes like you see people in their 50s, 60s, or even younger, and they, perhaps got a scowl, or they're trying to hide. And I think for a lot of them, it's I don't like the way I smile. I don't like the way that I look when I smile, so let me just not.
Okay.
But they don't realize how the world at large perceives them.
And since we're talking about an older population of denture wearers, I know there's young people wearing dentures, as you pointed out. So there's a lot of people that hate their denture, so they never smile.
Right.
Now, is this true also, that in a very short period of time, they could actually, on the day of the procedure, they could walk in with no teeth and walk out with teeth that are either snapped in or a fixed set of teeth that don't come in and out?
Yeah, absolutely. Like, technology has come a long ways, in everything, and in dentistry as well. And the technology exists for somebody to come in and walk out with a brand new set of teeth, whether they are locked in or whether they never come out. But we try to do everything nowadays where you never have to be without teeth.
Okay. Now, on the mini implants, back to those. So replacing missing teeth with the mini dental implants, how soon can they eat after the procedure?
Oh, they can eat right after. I mean, they get locked in and they walk out able to chew with either their denture or with a fixed set of teeth.
Okay.
And it's solid and stable from the time that it gets put on. So it really is pretty wonderful. I mean, I do a little trick in my office where at the end of the visit, I'll give them like an apple or something and say, here, try it out. Yeah.
It's got to be pretty scary, though, for them to bite into an apple with their new teeth.
Yeah, some of them, look at me, kind of go, "Are you sure, Doc?" And I'm like, "Yeah, go for it." And they'll say, "What if I break it?" It's like, "Well, what a better place to break it, while you're here."
Is that right? So they actually do that?
Yeah.
In the office. So no more dentures. I mean, you believe that? Like nobody should be wearing like for those people watching this, they think they're headed to a denture, right? Bad teeth. Maybe their parents had dentures. Mm-hmm. Come in, get a consultation.
Yeah, they come in, I'll evaluate them, we can take some images, and, but yeah, I don't think denture should be the end of the road for anyone now. For a long time, they were the end of the road, but nowadays it doesn't have to be, and it shouldn't.
The process, okay, so somebody comes in, either their teeth are so bad, maybe they need a full mouth of extractions, or the denture wear. What are their options in your office? So they come in. How does it work?
Well, they come in and we figure out the game plan, and if they need all their teeth extracted, then we will do that, but we will make them their new teeth beforehand. Okay. So that the minute that we take out their old teeth, we put their new teeth in. For example, you can get like 6 of these mini implants down on the bottom, and then get a full set of teeth that snap in and come out and snap in. But when they're snapped in, they're very solid and rigid, that they can eat practically whatever they want to eat. You can be very active and play sports and go on hikes and, swim or play tennis, and you don't have to worry about them falling out. Same thing with the top. You can put like 6 or 8 of the mini implants in and get a full set of teeth that snap in and snap out.
So in the upper denture, I mean, you could lock that in with mini implants.
Oh yeah,
Okay.
absolutely. Or for people who say that, I don't want dentures that come in and out anymore. Can we get teeth that lock in all the time? And yeah, we can. We can add a few more mini implants towards the bottom. Go with 8 or 10. The exact number doesn't really matter. It's based on each person.
Okay.
And then make you a set of real teeth that get glued in that never come out. They never have to be removed, and you don't have to take them out at night.
Well, it sounds like that's what everybody would want, right? Teeth that don't come out.
Well, it's the teeth that you had when you were young, before you had all these dental problems.
Okay.
So it's like going back through time in some ways, before to the days where you can take your teeth for granted.
But the upper denture, it has suction, right? Because the roof is covered. So the upper's fine most of the time?
No. Well, if you think about it, it's only fine when you never have to wear one.
Okay.
But when you actually wear one, you realize that the roof of your mouth is covered. There's this slab of plastic in your mouth that feels like a shoe sticking to the roof of your mouth when you're trying to eat.
Okay.
And for people who've had to wear dentures, their first week it's a pretty miserable week trying to get through this process, learning how to talk and learning how to speak, and this is what I can eat and what I can't eat. It's an ordeal. But with these mini implants, you hopefully don't have to deal with that anymore. So with the upper, with these mini implants, you can add 8 or 10 or however many, and then take out the part that's covering the roof of your mouth. And you get them locked in, and it's just like normal teeth again. They can taste their food, and they can eat whatever they want to, and they can chew whatever they want to, and laugh and smile and not have to worry about anything coming out. It makes a huge difference.
Now, I know a couple of denture wearers. I told you. And they never complain. Are you saying there's no such thing as a happy denture wearer?
Well, what they say about the person that complains all the time to their friends, they end up with very few friends afterwards.
Okay.
They might not complain to you and you might not hear it, but I see it a lot. And I hear people who are struggling with their dentures a lot. And they tell me about how they don't really go out as much. Their friends or family want to take them out to dinner, but eating for them has become a private act that they don't want other people around.
They don't like eating in front of people.
Yeah,
Okay.
because it's kind of a struggle.
It's embarrassing, I guess, too.
Yeah, it's quite embarrassing if you're trying to mash some food and things are sliding around and you can't talk well, and it really is. So what do people do when they're embarrassed? Well, they shy away from that embarrassment, so they don't go out to eat anymore. They go to a restaurant and they look at the menu, and automatically 2/3 of the menu is off limits for them because they know they won't be able to eat it, and it's a problem. I have this one lady actually who came into my office, and she got brought in by her sister, and I didn't really know the dynamic, and she had makeup that was very off, for her. I'm not a makeup expert, but it was
Okay.
just very off for her, and I was thinking like, well, I don't understand the dynamic. I'm try to get to know her a little bit. And later I found out from her sisters that she has been wearing her dentures for 6 or 8 years, and she stopped going out. So she hasn't even put on makeup in such a long time because she never went out unless she absolutely had to. She sort of became a recluse. And, so her sister said if she looks a little bit off, please don't judge her because...
So you gave her her teeth back.
Yeah,
And she started putting makeup on for the first time.
Oh, yeah.
And the makeup didn't look quite right.
Yeah.
She had to get used to wearing makeup again.
Yeah, and we actually gave her, I think 6 or 8 mini implants on the bottom, and we snapped in a full set of teeth for her. And and I saw her a few months later, actually, at the gym. She was in a yoga or Pilates class. I don't know, one of those classes.
Yeah, yeah.
And I thought, like, oh, wow, like, she looked good. She was, like, wearing outfits that, like, suited her. She looked happy and healthy. And her makeup was completely, like, on point. And, she came over and said hi. And I thought, like, oh, like, it's really nice to see you. And she goes to my gym. I've never seen her before.
Good. So no more dentures.
Yeah,
That's a thing of the past.
It should be a thing of the past.
And pretty much everybody's a candidate. I mean, young or old. I mean, 80s, 90s, doesn't matter.
Yeah, everyone can be. Some cases are tougher than others, but everyone can have something done.
Okay.
To make their lives a little bit easier. Everyone can have something done to, make their dentures a little bit more stable, or to get real teeth that aren't dentures. The technology has come a long ways.
But isn't it true, though, that if you've been wearing a denture like 20 years, you can't do this? You don't have enough bone?
No, absolutely not. We have a lot of different things that we can do. We can rebuild bone, we can regrow bone. We have these smaller diameter implants that doesn't need as much bone as we once did. And that's really not the situation anymore. I've seen some patients that personally have been told that they didn't have enough bone, but they had enough bone for these newer types of implants.
Okay.
And it worked.
Nice. Now, you have a practice, I guess, where you do everything under one roof.
Uh-huh.
I guess how this process is done, you go to one person that does the surgery for the mini implant, and another person puts the teeth on top. You do it both parts. You've had training in both parts.
Yeah, no, I do both parts. I've been trained in the surgery parts. I've been trained in putting the teeth on top parts. And I just find it makes patients' lives a little bit easier where one person sees them through from start to finish. And I also take care of them afterwards. I see them for cleanings and maintenance, so that I know what their deal is and what their story is. I try to keep it simple and straightforward.
We're out of time. Final message to the person that's either headed to dentures, bad teeth, or they're already wearing a denture, but for whatever reason, they're still skeptical about what you're saying. Maybe they're fear of the dentist. Maybe they think they're too old. What do you say to them?
Well, I just want to invite them in to come in and chat with me and ask me questions and have a conversation and at least know your options and know what's out there.
Okay, good. I want to thank you for coming on the show. Great stuff.
Oh, thank you.
You've been watching The Wellness Hour, news that makes you healthier. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.